I love the safety profile of Morpheus8. It used to be that I only had lasers to rejuvenate the skin, improve fine lines and wrinkles and skin tone and texture. But now with Morpheus8, I can address all skin types, Fitzpatrick 1 through 6, which is lightest of the lightest skin to the darkest of the darkest skin, and it's very safe. In addition to that, I can treat the deeper layers of the skin very safely without any peeling because that energy is being deployed below the skin.
First of all, Morpheus is an unbelievable, powerful technology. The reason that it works is because it's so powerful. On the same note, it's very safe. But as any provider, anyone that's working on humans, you have to know your limitations. You have to understand your technology. You have to be intuitive in how you apply it. So we know in our field that everybody is putting a ton of fillers and things to keep their fat masses around the mid-face. So it would behoove us that if we're going to treat with a Morpheus, we don't go so deep that we're going to take away from that fat mass that everyone wants there. So it's a matter of understanding your technology. It's a matter of understanding your patient that you have and the different variables that you have to improve it. But if you understand that, your results and the safety of it is the best in the market. You know, normally when my patients are asking me about safety, I definitely like to go over the risk, benefits, and alternatives to all that they have. That's part of what we do as physicians. Then we also spend plenty of time explaining to them what we recommend, what we feel is going to be the best outcomes with the least risk. And that's almost always Morpheus when we're talking about skin tightening, improving in all the aspects of the skin. So I tell them, that number one, on top of it having good outcomes, that the technology behind the Morpheus is very safe, and the likelihood of having anything that's permanent or anything that's going to cause them any issues in the long run is slim to none.
Every procedure has safety concerns, of course. So the most important thing with Morpheus, I think, is assessing the skin type. So we use the Fitzpatrick scale as well as the ethnicity of the patient, because of course we want to avoid things like hyperpigmentation and etc. So I always advise them, depending on your skin type, these are the settings that we can use, and these are the settings for the goals that you want to achieve. And then we make a decision from there.
Morpheus has been out for at least 5 to 8 years, right? And so the safety data is out there. And not only that, but radiofrequency microneedling in and of itself is very, very safe. I understand that Morpheus8 is different from other companies as a bipolar radiofrequency where you're going to get the electrodes from the end plate to the tip of the needles. And so when you build that in for lots of practitioners, not only for surgeons and physicians, but for other staff members who are doing it, it's a very safe technology. And I think it's great that the company really, really focused on the safety and efficacy of Morpheus8.
Well, like with any other device, whether a laser, whether radiofrequency, whether a microneedling devices, it's based on one, technology. Two, it's based on that person that's providing the care and utilizing that device with that individual. And I think if you understand that and you explain to people and you understand the person that you're dealing with, whether their skin type is skin type 1 versus skin type 6, that device can be utilized safely under those circumstances.
Well, there's always a concern about safety with all of our clients. We want to make sure that they're fully educated. But with the technology of Morpheus, as long as they pay attention to some very key principles, to be cautious of going out in the sun afterwards, screening our patients properly with medical histories. Our nurses are very specific with selecting patients that will get optimized results. We're looking at different skin tones. We're looking at different parameters to make sure that it's the proper patient for the technology. So once we have met those criteria with our patients, we are able to give them assurances that they are able to get the technology delivered properly with very little risk or downtime.
Regarding the safety of Morpheus, it's a safe device. It's a powerful device. There has never been any concerns, really, at least from my patient standpoint, is it safe or not, because I convey that to them. I'm very comfortable with performing the treatments. I understand the technology. I know what I'm doing and why, and I think that's key when it comes to determine the safety of the product.
When our patients come in with concerns about Morpheus8, whether it's safety, whether it's pain, we do tons of education. This machine, if it's in the right hands, is 100% safe. If the settings are followed correctly, then it is not as painful as the internet makes it seem. So overall, it's tons of patient education.